1 in 3 of orthodontic patients are actually adults. Here are 14 things that you need to know. Before we get into that though, be sure to subscribe to the channel and like this video. Question number 1. Can adults get braces? Well, yes, that would make sense since 1 in 3 orthodontic patients are actually adults. Will insurance cover the cost of orthodontic treatment for adults? Many plans do not cover orthodontic treatment for adults, but there are some plans out there, so if you feel like you need help from insurance coverage for orthodontic treatment, then you might try to do some research, see if you can find a plan that includes some sort of orthodontic coverage. How much do adult braces cost? It probably depends. Some providers out there, orthodontic providers, may promote some sort of orthodontic, like an adult orthodontic fee. There are also probably many providers that essentially have one fee regardless of if you are an adult or a child. And this is because cost is associated with different things like time in treatment, appliances used during treatment, and maybe treatment plan. Can't answer the question completely. There may be more in the treatment for adults and children than you realize. Obviously there's differences, but well, why would an adult need braces? Let's talk about cosmetics. Everybody likes the way straight teeth look. So cosmetically speaking, most people have something they could do to improve the straightness of their teeth and the way that their bite fits together, going towards facial harmony. As an adult, right, we're probably seeking out employment now, so we have relationships with people. We want to look good. So outside of the cosmetics though, there are some other things that are important for adults to consider. Braces can help with straighter teeth, can fix the bite, which can help with oral health. As we get older, we seem to be more predisposed to gum disease, or we end up with gum disease. That's periodontal disease. Gum loss, bone loss. Not good, but we definitely see it more in adults than we do with kids. And if you get gum loss and bone loss, mostly bone loss, what's gonna happen to your teeth? Fall out. And we see that way more in adults than we do in kids. Straight teeth and a good bite can help you keep things clean, can help you maintain the teeth, keep them cleaner. It can even help the dentist get in between the teeth to help avoid plaque buildup, cavity formation, inflammation of the gums, which drops down into the bones and then eats the bone away, right? All those things can be improved with straighter teeth and a better bite. As adults, we run into the situation where we may have lost teeth, cavity, or bombed out tooth from a cavity that might need a root canal, and you're just like, well, let's just take it out. It's cheaper that way. At least some people experience that. And so now you have a space in between your teeth. Over time, teeth can tip into that space, leading to changes in bite, or teeth from on top. If you take out teeth on the bottom, you'll notice that the top teeth rest on the bottom teeth. Well, if you don't have a tooth on the bottom supporting teeth on top, what happens? Those teeth on top tend to come out, and it can keep dropping down and dropping down. It can drop into the space, it can drop onto the gums on the bottom when you bite on the bottom arch. That can hurt when you bite down, and or if you decide that you ever want to put an implant in here, that's not going to work because the tooth is down. So braces can help manage tooth loss or manage space from tooth loss. And then of course, as adults, if you have skeletal disharmonies like a severe overbite, orthodontists call excess overjet. If your lower jaw is just like set back really far, you can check out our other videos. We've got plenty. The only real way to fix a problem like that is through surgery. Adult braces can help with that. Okay, what should you do before you get braces? We can either see your dentist or your orthodontist. Sometimes people come to the orthodontist because they were at their dentist and their dentist is like, hey, you need to go get these teeth moved around first, straighten them out, so then we can consider, putting this crown in a good spot. Or you want to get veneers, right? You want to make things look really good, and the dentist knows that if you want the best looking, potentially the longest lasting restorative work, veneers, crowns, then it's good if your teeth are in the best positions. Or sometimes you're just like thinking about it, go to the orthodontist, and the orthodontist says, well, based on what we see here, this is what we could do, but first we need to review with the dentist because we want to make sure that your teeth are clean, your bones are healthy enough for us to move the teeth. We want to make sure we have a plan about, hey, you're missing a tooth here. What are we going to do? We're going to put an implant in there. Are we going to put a bridge in there? Are we going to try and close the space? Or maybe we have a really deep bite and our bottom teeth here as an adult have worn down and the dentist wants to put crowns there too. So the orthodontist needs to know that we've got to really open up that bite so we have clearance. So you need a thick enough crown that's going to be able to last long enough. In order to do that, you've got to have the space to put the crown on the tooth. So the orthodontist and the dentist have to work together. Sometimes before you get rolling as an adult, you need to check all of your gum heights, not just the bone. You need to check your gum heights. Specifically in the front here, we've got very thin bone and tissue usually around those front teeth. If you've got crowding and you try to line those teeth up more, they tend to come forward. And if the teeth come forward, move forward, they move towards the outer parts of the bone. And if the bone goes down because you've moved the tooth through the tops of the bone, and that means the gum tissue could go down and you could end up with gum recession. It might be good in some cases with really thin bone and tissue that you get a gum graft before you go through orthodontic treatment. So those are all things that you want to consider before you get the braces. procedures. In addition, you definitely want to review your medical history with your orthodontist. There are certain medications like bisphosphonates used for cancer treatment, osteoporosis, that's a fun word to say, and that can slow down tooth movement. TMJ problems, sleep apnea, diabetes, other medications or hormones from, associated with pregnancy that can affect gum presentation. All those things are important for your orthodontist to know. And those are all things that you might be more likely to have to share when you're an adult. All right, here's an important question. Do you have to get metal braces? The answer is no. Metal braces are for sure tried and true, but there are things like clear braces. Usually there's metal wires, so you get like a little bit of the invisibility. They're coming out with all sorts of cool brackets, and so you don't have to get the traditional approach. But just remember, we've had another video about this, that all brackets essentially are equal in their ability to help you get to the desired result. So don't let anybody tell you that one is better than the other. It's just probably personal preference. And then you have clear aligners. Those are some of the newest, coolest technology out there. There's lots of companies who are pursuing this and proposing this. Invisalign is one of the biggest brands and is by far the most studied brand in the research. And these clear aligners can do a lot of great things. Depending on what your needs are though, the more complicated the tooth movement, the more complicated the procedure that's involved, you may want to weigh benefits of metal braces, traditional approaches versus the newer technology like clear aligners. Do adult braces take longer than kid braces? Not necessarily, but I bet you a majority of orthodontic providers would tell you that tooth movement seems to happen faster in the kids, and their teeth, their gums, and their bones seem to be more resilient in response to all the tooth movement, all the orthodontic force that we're putting on them. And that actually makes sense, right? There's lots of things that we see as a result of aging. Adults they don't respond as well as the kids do. That being said, in theory, adults with healthy teeth, gums, and bones, and assuming no like crazy medications or things that might inhibit tooth movement, they should have teeth that respond in a reasonable way, be able to get similar outcomes. When we plan for adults, we don't necessarily plan for way longer, because adults can achieve similar outcomes to what you can with the kiddos in similar amounts of time. Can adults do expanders? If you're talking about trying to get a sutural split, right, when your bone's in the middle like this, and you're trying to spread them apart to get the teeth to be wider, maybe you're trying to fix a crossbite, or maybe you're just trying to make more space. In order to get that in an adult, it becomes less and less predictable with age, and so you need adjunctive procedures to help. Sometimes like screws in the expander that go into the bone that help, and then even then sometimes you have to go into the middle of your bone here surgically and split it down the middle. It doesn't make us happy when we have to send you for this kind of stuff, but people are talking like, can we do adult expanders? This is the upper jawbone. Yes, I can take an expander or braces and put it in here and make your teeth wider, right? I can tip the teeth out, and that's different than actually getting a sutural split. Same thing with the mandible, except there's no real suture here, and so in order to expand the bottom jawbone, you're talking about like cutting through the jawbone. That's definitely not easy, but it is very different than just trying to widen this dental arch with braces, right? You can tip the teeth. That's tipping, not actually splitting. Can adults use the Herbst or other things like the Mara or a Frankel or a Bionator? And the answer is not in the same way that you can do with the kiddos. You're trying to use those devices when the kiddos are young because you're trying to take advantage of growth. You're trying to modify that rapid rate of growth and control the direction. It doesn't grow jawbones, but it tries to control the direction of the growth that you have. But you can only do that when you're a kid and you go shoot like this. Once that growth comes down here, if you try to use a Herbst or something like that in an adult, you're gonna push that jaw forward like this, and it's gonna look awesome. It's a postured forward, and then as soon as you get it out, it's probably gonna go like this, or at least you'll be able to take your jaw and go like this as an adult and put it right back. That is the likely outcome. So Herbst in adults with excessive overbite, that's not what I would do. If you're kind of went through puberty, or you're maybe like a year or so after like fastest rate of growth, maybe it's like worth trying, because the alternative is you take out teeth on top or surgery. Can adults do mewing and fix your jaw position? And same thing. The answer is to use that to try and change your facial form in a significant way that mimics what happens when you're a young child going through puberty. I don't think so. Is there a best retainer for an adult? The answer is no. Retainers are retainers, and you need to find one that will fit your particular needs and one that you're going to wear. And that's something you want to discuss with your provider. Can you do IPR as an adult? IPR, remember, shaving in between the teeth? And the answer is yes. If you're particularly sensitive already, you have sensitive teeth, maybe you let your provider know, and maybe that's something you don't pursue. But again, in theory, if you have healthy teeth, you're not overly sensitive, you got good gums, bones, IPR could be a very reasonable technique to pursue, even if you're an adult. Can you take out some of the bad teeth? Root canals, crowns, fillings. You totally can take out those teeth, but just keep this in mind. Sometimes those teeth are further in the back. The further away from the problem, right? And the reason why you're probably taking out teeth is maybe severe crowding, and the further away you get from where the crowding actually is, the more mechanically challenging. So in that case, it could take longer, more challenging challenging, but it might be worth it to you to save other good teeth and get rid of some of the bad teeth. So can you straighten teeth with adults? Yes. Can you manage impacted teeth? Check out our other videos like the impacted canines. Can you do that when you're an adult? Yes, you can. Can you go through surgery as an adult? Yes, you can. Can you extract teeth as an adult and try to close a space? Yes, you can. At some point, you're probably gonna say, well, do the benefits outweigh the risks? What are the risks of adult orthodontic treatment? My personal opinion is that adults tend to be more at risk for bone loss. Could be because we have other medical conditions like diabetes. If you have uncontrolled diabetes, you can end up with bone loss. But specifically as it relates to adult tooth movement, hopefully you're not moving teeth when you have uncontrolled diabetes or you have active periodontal disease. That wouldn't be good. You're definitely asking for bone loss. But trying to move teeth a significant amount, like closing extraction spaces, the bones of adults are a little bit different density. And so moving those teeth through the bone significantly or a considerable way, some of the cellular processes, maybe they don't respond as fast or as well as efficiently as you do when you're a kiddo. So root resorption, where the roots get shorter, maybe you're at a greater risk for that. Gum recession, you might get that. You might start seeing the roots of your teeth a little bit more. Black triangles in between teeth, right? You can see how the papilla of the gums here, it fills in between the teeth so you don't see a hole. But if the gums pull back up, because for whatever reason, you can see a hole through the teeth because the tooth shape is kind of like this. They touch here and the gums fill in here, but then when you spread them out, boom, you got a space in between there. It's hard to fix. And as adults, you might be more inclined to experience those things. So those are potential risks. If you're talking about significant movements, we have our joints here. And if you're a 40-year-old adult, your joint has been operating with this bite for a really long time. And if you go change it, in theory, there is the potential that this joint has to adapt. And if it doesn't adapt well, then you could develop or you could encounter TMJ related symptoms. Now, just to be clear, braces don't cause TMJ problems. Those are some risks for orthodontic treatment for adults. I hope that was helpful for you. Credit goes to Dr. Bennett for recommending this particular topic. I hope it's helpful. Just because you're an adult doesn't mean that you can't have braces. Lots of adults are getting braces, and there are definitely some benefits. There are some risks, but be sure to visit your local provider and your dentist, find out what is gonna be best for you. That's all I got, just a little PFO so you know where you're going. Packard out.